Sports medicine is a vast subject due to the related injuries and ailments that can be caused from both competitive and recreational athletics. Sports play an important role in the lives of millions of Americans. Many Americans start their children off at extremely young ages, and those that are not in some of the main sports, such as football, basketball, or baseball, are out participating in an activity that would be considered athletic in nature. During this video, we will discuss the top 10 sports injuries, and in no particular order. Please understand that these injury types are not the only ones that can occur. Achilles tendonitis. This is caused when the tendon in the back of the ankle, known as the Achilles tendon, is overused and becomes inflamed. If this is left untreated, it can become almost impossible to run or even walk. A concussion is an injury to the brain which is typically caused by blunt trauma or a blow to the head. Symptoms could include disorientation, blurred vision, headaches, dizziness, and sometimes nausea. Concussions are most common in sports such as football, hockey, boxing, and other contact sports, but they can certainly happen in everyday life. A groin strain will usually take place when changing direction very quickly, thus straining the muscles of the inner thigh. The groin is also known as the adductor muscles, which are situated in the upper thigh area and serve to pull the legs together. Shin splints refer to the pain on the inner side of the shin bone or tibia and are caused by inflamed tissue surrounding it. This is common in people who are not used to exercising and try to increase the intensity of their workouts too quickly. Lower back pain is everywhere, especially in golfers, runners, cyclists, tennis, and baseball players. Lower back pain is even more common in sedentary and overweight folks than in athletes, but is certainly not confined to the non-athlete. Pulled muscles. Not warming up, fatigue, and the lack of flexibility are contributors to pulled muscles. The most common pulled muscle is the hamstring. Running, jogging, basketball, soccer, and football participants are most likely to find pulled muscles. Elbow injuries account for 7% of all sports injuries. Tennis elbow consists of tendon degeneration in the elbow due to repeated backhand strokes in tennis. It can cause intense pain on the outside of the elbow. Golf elbow, on the other hand, usually affects the inside of the elbow, which is known as the medial epicondyle. These injuries can be very painful and can turn into an ongoing issue if not treated properly. Soccer, hockey, basketball, and volleyball participants often find themselves sitting on the sidelines with an ankle sprain. However, getting out of a car in the wrong way or even stepping off a street curb can be the culprit of such a common injury. With an ankle sprain, it is important to make sure that there is no more serious injuries, such as a fracture. Your doctor may recommend an x-ray. The need for treatment of an ankle sprain is highly recommended. About 20% of sports injuries involve the shoulder. Dislocations, sprains, and strains of the shoulder and rotator cuff are very common. These injuries are often found in tennis, swimming, weightlifting, baseball, and volleyball participants. Overhead movement is a common culprit. You will find these issues to be very painful, and they can cause stiffness, weakness, and instability of the shoulder. Knee injuries are the #1 sports-related injury. 55% of all sports injuries and approximately 1/4 of all problems treated by orthopedics are knee injuries. Runner's knee is a common reference for general knee ailments and is often found in swimmers, cyclists, football players, basketball players, volleyball players, as well as runners. If left untreated, these knee ailments have been linked to arthritis. Prevention is the key to sports injuries. However, you can't always prevent an injury. Stretching and participating on the level in which you feel most comfortable is the best advice for prevention. When and if an injury does occur, please seek treatment as soon as possible. This will help you to avoid further complications that may keep you from participating in future athletic activity. I hope that I've been able to help you better understand sports medicine and, more importantly, how to manage it and have your children and loved ones live life at their best.